Hello, everybody, and welcome back to the Busch Systems Green Thinking webinar. This month's program is Diversion and Waste Reduction in Veterinary Facilities. We have two representatives with us. We have Dr. Dickon Westworth as well as Julie Criodo. Just give me one moment here. We do apologize. We were having some technical difficulties on our end, so this is a little bit of a scattered introduction. So as mentioned, we have Dr. Dickon Westworth from veterinary he is a veterinary neurologist with the Veterinary Sustainability Alliance, as well as Julie Crodel, who's a sustainable waste advisor with NG Impact. We do have chat functions available as well if anyone wishes to engage in our chat, or as well as any Q&A questions. There is a Q&A function. We will also be holding a Q&A later on in the program with both Dr. Dickon Westworth and Julie Crodel. And for starters, I will pass things along to Dr. Dickon Westworth, and we can get started.
Great. Well, thank you. Morning all and welcome. Thank you very much for that kind introduction, Tyler. So I'm going to start it with an overview of waste prevention, and then Julie's going to present on waste advisory programming and developing a zero waste strategy. I'm then going to return to take a deep dive into practical and readily implementable methods to mitigate the problem of waste in veterinary medicine and how to transition to reusable materials. There we go. So to begin, I'm actually not going to talk about waste, but waste avoidance. The advent of cheap plastic synthetic materials and the emergence of deadly contagious diseases such as HIV, Hep C, prion disease, and others really heralded the ultimate throwaway single-use industry, modern healthcare. And until recently, we have used a linear economy model that takes from resource extraction, manufacturing, production, through packaging and delivery, use, and then to discard. But to become more sustainable, it is vital to evolve a circular economy that strives to keep all the materials within a reuse, repurpose, repair, recycle circuit, thereby limiting resource depletion, energy input, and waste accumulation. After all, getting the most value out of the resources we have by keeping them at their highest utility and value just makes good business sense. Now, every product and most services impact the environment in multiple ways and across the value and supply chain throughout their lifespan. And a detailed analysis of this process is known as the life cycle assessment of a product. Now, for an individual, gathering this LCA information on products is very challenging. And procurement guides are an essential tool in this endeavor. And a US veterinary specific resource is this one from Dr. Duncan's group at Colorado State University. I also suggest you contact your supplier for environmentally friendly products and services from companies with clear sustainable initiatives or hold a B Corp certification. Really encourage them to reduce packaging, use reusable and recyclable materials, and consolidate deliveries. Because if they can take back packaging for reuse rather than more energy labor recycling, that's another great step towards being more sustainable. And look for products with certifications such as the Eco Label Index. Now, long term, we really want them to strive to take back products at end of use for product recycling. And this is particularly important for electronic products. Moreover, this can also help a manufacturer really differentiate their product in a carbon-constrained world. This is part of the extended producer responsibility conversation. Now, what you can do at your own hospital is also have your hospital team coordinate, work closely together to consolidate ordering and limit the need for dollar and carbon expensive things like expedited or air freighted deliveries, for example, and always be on the lookout for greenwashing. Okay, so now on to waste. Let's begin with some grounding, because if one does not embrace the hard facts of the degree of the problem, there's no reason to care, change our mindset, and make enough effort to mitigate the existential waste crisis. So since 1950, more than 9 billion tons of plastic have been produced, with half of that produced in the last 15 years. 40% is single use, and only about 11% of that is recycled. And just within the US healthcare system, more than 6 million tons of waste are produced annually. And the COVID pandemic literally doubled global healthcare waste, of which about 30% is plastic waste. And waste is polluting much of our land on which we live, many of our waterways, and then flows onto the ocean to create country-sized garbage patches like this one off the coast of California. As you can see here, this is called the Great Pacific Garbage Patch, which is 3 times the size of France. And the production and wastage of these materials can cause health harms far distant from site of disposal. You can see on this New England Journal of Medicine article on the left, patients with carotid artery plaques in which micro or nanoplastics are detected had significantly higher risk of heart attacks, stroke, and death. And then on the right, you can see this 2024 study, and it showed the attributable disease burden of chemicals used in plastics back in 2018, such as PFAS, amounted to a cost of more than $250 billion, approximately 1.2% of GDP. And healthcare workers at all levels are becoming increasingly concerned about the impact of healthcare plastic waste. And for this reason, a global sign-on letter, which I, and likely many of you also signed, was distributed by Healthcare Without Harm to healthcare workers, urging negotiators of the Plastics Treaty to ensure that the healthcare sector is not exempted. And the final meeting is going to commence in November. Now, to highlight one example of environmentally damaging plastic, let's just consider PVC for a moment. This is one of the most toxic plastics from manufacture all the way to discard, and yet is also one of the most commonly used in healthcare, accounting for about 27% of medical device material. And from the production of the chlorine, often requiring mercury or asbestos, to the monomer production of vinyl chloride, which is actually very toxic with significant risks to the manufacturing workers, onto the medical devices where phthalate plasticizers like DEHP are added up to 40 to 70% by weight to make the brittle PVC flexible. Those phthalates are androgen disruptors, and they affect neurodevelopment as well and can promote chemotherapeutic drug resistance. And when incinerated, PVC produces dioxins and furans, which are some of the most toxic substances on Earth. And exhausted into the local environment, these are extreme carcinogens. PVC is also very challenging to recycle, and although there are some breakthrough methods like electrolysis, it's still challenging. Now, we and many others are ditching PVC medical materials and transitioning to PVC-free products like these here, Fleboflex, which instead are made of polypropylene. And okay, that's pretty depressing. So what can we all do about it? Well, my first recommendation is to contact your local waste facility, engage and collaborate with them. They're really a great resource and can really help you get started, especially on appropriate waste segregation, including what they can and cannot recycle and compost. We had a representative group come out and meet us and tour the hospital, and we created an initial waste report based on that. It's also essential to learn where and what happens to all that waste and how it's processed. So our landfill recycling and compost waste hauler, that's Recology of Sonoma Marin, has a brand new state-of-the-art materials recovery facility, and these have an 85% efficient general recycling for waste segregation rates. This is one of the highest in the country, and an exceptionally high rate for aluminium specifically, probably more than 95%. So they've got 7 optical sorters with air nozzles, a spinning magnet for magnetized metals, a highly efficient eddy current separator for aluminium, and even last chance manual human sorters at the end of the line. Now, most recyclable plastics like polypropylene or colored high-density polyethylene or PET goes to plants in SoCal, Baja California for things like downcycling into apparel, furniture, decking, etc. But if they're non-colored or called natural plastic, they can even go back to high-grade plastic production. And not only that, all the landfill goes to a local Republic Services site with 180 wells for methane recovery and a power plant that can power 3,000 homes. And this can really help keep egregious methane out of the air, which over 20 years has 80 times warming potential of carbon dioxide. And it's important people realize these things so that they know that it's really worthwhile recycling, and it isn't just going to a third world country any longer. Now, to emphasize again, the first steps always to rethink all our purchases and switch when possible to reusable materials when you can. Really become part of that circular economy of materials. And then we want to follow this hierarchy down. Refuse and reduce the use of disposable plastics where possible. Repair materials and equipment. Recycle paper, metal, most plastic materials, and definitely all that electronic equipment when otherwise unrepairable, ensuring to deposit in a waste stream that can utilize those really important components. And lastly, rot or compostable material in appropriate aerobic sites that avoid the anaerobic conditions of landfill that create methane. And this infographic was copied from an excellent waste article by Dr. Ellie West and colleagues in the UK, and the reference is provided here. And it's important to understand that we still generally place excessive emphasis on recycling. It's important, but only one aspect of waste diversion from landfill. And many cities and states do it terribly. There's a real vast variation in recycling rate. You can just tell here, West Virginia has about a 2%. 9 of the worst states are less than 10% listed here. California comes in an okay 41, but even Maine is only about 65% for general overall packaging recycling. And recycling will decrease waste to landfill, but given all the upstream and later downstream costs, including transport of materials, processing, remanufacture, water, particularly for paper, energy for paper and aluminium, this is really an imperfect system. And in fact, when we consider the entire LCA for paper and cardboard, recycling only saves about 30% of carbon emissions compared to virgin, albeit less environmental impact. And currently, about $6.5 billion worth of materials that could be recycled are lost to landfill. But it's been estimated that the total annual benefit, if recycling was done optimally, could amount to as much as $70 billion in total value to the economy. And so with that more positive note to end this waste overview, I'm going to turn over to Julie. Thanks very much.
Hello, everyone. This is Julie Crudell from NG Impact. I'm just going to hold real quick while we switch the presentations. And change the control. Thank you. Okay, so I don't have the option to advance the slides. Tyler, could you help me with that?
Sorry about that. Just give me 1 second.
Ah, yes. Okay. So my name is Julie Crodell. I work at NG Impact, and our company focuses mainly on energy advising, but our team is also working on waste reduction and diversion strategies. What we do is we build strategic plans and customized roadmaps for sustainable waste management solutions. We also do waste regulation compliance audits, but that's a whole nother topic. And I had the opportunity to work with Dr. Westworth and his team for about a year now on programming for their clinic. I don't think I can advance the slides. There you go. Okay. Depending on where you are in your journey towards a sustainable waste management practice, the 4 pillars that we like to focus on is to conduct a waste audit, so you understand how much waste your facility building produces, and to assess the opportunities. Usually, going back to what Dr. Westworth was presenting, as a consumer, whether you are an individual or whether you're working in a veterinary clinic, you have some type of leverage of the products that you are using. So, you know, what products are you purchasing, what products are coming into the facilities, and what happens to the products that go out of the facility. A waste audit usually gives you a good idea of, you know, the composition of your waste. And then based on the results of that waste audit, you can develop a roadmap. And if, you know, you don't know where to start, we can help with that. And just set clear goals on, you know, what you want to achieve when, so you can work towards those goals. We like to emphasize that, you know, this is a journey. This is not a, you know, trajectory. Usually what we see is there's like, you know, some goals that can be achieved, and then something changes, new services become available, new products become available, there are supply chain changes that might affect you. So this is a continuous journey. What we like to focus on is also the validation. So just one waste audit will not give you a good idea of whether whatever you implemented is working out. What you need to do is you need to come back several times and see what's happening on site. Is this working? Is it not working? Do we need to adjust? What would make most sense? And what should we focus on? Moving on. So the recommendation and what we've been working on in the past year with Dr. Westworth was, you know, you need to have a clear understanding of the processes of each facility. A goal can be set from, you know, a corporate level or management level, but the goal can only be achieved if you really know what's happening at each facility. You need to observe where the waste is generated, how the waste flows, and you want to kind of figure out what works for a facility and what does not. This leads into developing the roadmap. So with the data collected on site and during the waste characterization audit, you kind of then can figure out what is most important. What do we want to focus on first? What's the low-hanging fruit? And then, you know, work on the more challenging aspects of your waste management program. For the implementation part, it is really important to conduct training and socialize the diversion goals. We like to focus a lot on the behavioral aspect, creating that culture around zero waste. If you know, individuals usually come from different cities, they come from different backgrounds, and they may be engaged, they may be not engaged, but what we find is that it's really easy to steer the conversation towards zero waste and engage everyone on the team around why we're doing this and why this is so important. And Dr. Westworth will show you what they did in their clinic later on. And then just for the validation part again, I mean, going back to step 3, if you have validated the progress or the accomplishments of your waste management program, it's always good to celebrate yourself and the team. And I mean, let's face it, it takes additional work to set up a functioning waste management program. So always go back, celebrate yourself, even if it's just a small step. It is a step towards reaching that sustainability goal. It's really challenging to start on your sustainability journey. We usually see that, you know, you have a plethora of really nice waste stations available that you can choose from, but we always find that, you know, the budget may not be available, the space may not be available. Let me jump to the next slide, actually. This is the reality of you know, what it looks like in a facility, in a veterinary clinic. You do not have you know, governance over your outside dumpster, because you're in a mall space, or you're sharing that dumpster with somebody else, or your landlord shares that dumpster. And you might not have buy-in from all the stakeholders. You might have limited space, and there might not be budget, or suddenly there are changes in priorities. So you might be 1 or 2 years into your waste management plan, and suddenly it's not important as much anymore. So this is something to keep in mind and to not get discouraged. What we like to, again, focus on is it's a journey, and every little step counts. So as long as you continuously improve and move forward, that is what we like to focus on. So I can go over the operational aspects of the 4 foundational pillars. And I think I kind of touched on that, but the site tour is just super important for any waste management program. If you're managing multiple facilities, you want to kind of understand the differences between facilities. What are the challenges right now? What is the vendor situation? And collect feedback on what they would like to see to get their buy-in. For the waste characterization audit, depends on whether you have done waste characterization audits. There's a lot of good webinars out there. You can do it yourself, depending on the material that is, you know, available. Sometimes people are grossed out by digging through trash. I myself am not. I find it really interesting to see the different materials that are discarded. And in any waste characterization audit, you will sort the sample by material type and then record the weight and volume. Recording the weight and volume is super important because that allows you to set priorities. For example, you might go in thinking that, you know, we want to focus on gloves and PPE, but when you do the waste characterization audit, you find that you do not have a lot of gloves in your waste. You find that you have a lot of textiles, and adding up those textiles per month, per year, that amounts to a huge mountain of materials. So you might want to focus on that first. Common waste categories in veterinary clinics that we see are usually we see a portion of current recycle, so materials that can be recycled in within services that exist within the operation. Those are usually like cans, cardboard, boxboard, sometimes clamshells. It depends on what is accepted by the vendor in that municipality. Usually we see new recycle opportunities. There are a lot of vendors out there that will accept specific materials, and it takes some research to find those vendors. Dr. Westworth has done an excellent job in procuring new vendors for certain materials, but then you also need to ensure that the team is on board and that you're really moving those materials away from the trash and having them collected separately. A big piece of the pie that Dr. Westworth also touched on is procurement. This is super important. Your purchasing decisions influence, anybody who, in the supply chain, and your individual requests will influence the products they offer, the catalog they share, and then also, will tie into that concept of circularity. Most waste management programs look at the downstream, what's coming out of the facility. And the point that Dr. Westworth and I want to make is, you need to look at it from cradle to grave. You need to look at it from the beginning to the end. We cannot just focus on, managing the waste after we discarded it. Landfill is always a portion. There are just certain materials that you cannot find a recycler for, or that you cannot reduce, or that you do not have an option to reuse. Those are just, a portion of the pie that will always exist, but we like to focus on reducing that portion of the pie. And you might start out in your waste characterization with, focusing on certain aspects of your pie and then going through that landfill portion again and again and figuring out what else can be done. And then regulated waste, we usually focus on landfill waste for veterinary clinics, but we also find regulated items in the landfill waste. So just ensuring that you have a solid waste management plan for regulated waste and continually train and communicate about items that should never be placed in the trash, in the waste that goes to the landfill, to protect your team and to protect the communities that you live in. So I compiled some of the examples that we found in veterinary clinics. Commingle recycle is usually a big part and a low-hanging fruit. So just having the correct signage, having the bins available in the spaces where these materials are being generated. These are all parts that you need to, after the waste characterization, during the road mapping process, kind of communicate, align on, and ensure that everybody is on board with diverting the materials that are accepted by your vendor. Cardboard, we see a lot of boxes that are not flattened. In that case, we always advise on flattening those. We will hauling air if you don't flatten them. Compost is a category that you might not have a compost vendor available in your area. In that case, there are other options out there. Sometimes you can add composting as a team exercise. Yeah, there are different options out there. Please reach out if you have any questions, and I'm happy to brainstorm or provide some ideas. Of course, we find medical packaging. This is something that usually in weight doesn't make, is not a big impact, but volume-wise, it's flimsy. It's not really easy to find somebody who will accept this. So the options here would be to, one, discuss with the supply chain if there are other packaging options, look at, combining shipments, and then if there's still materials that are out there, finding a vendor that might accept certain materials or all materials. Used medical plastics, same. As Dr. Westworth explained, there are new products available that allow you to sometimes switch. Sometimes you don't have the option. There's also vendors out there that might accept a portion of those used medical plastics. And really, it depends on the budget available. It depends on the location. It depends on, what priority you put on diverting these materials from your landfill waste stream. Oops. Uh-oh. Okay. And then just why is this an important factor as part of your operational and sustainability strategy? One, usually we see cost savings in many areas. The cost for trash is increasing. The space is running out, and usually if you have the option to divert into commingle recycle, it will be cheaper, and that can be calculated out. You can do a cost benefit analysis. You can communicate to your team members as well as your communities that you are taking on that environmental stewardship, and you can communicate the successes. So that is always a good way to engage the community and share the processes. And then in that same realm, you increase your public image. Supply chain resilience, this is super important. The resources available for everyone on this planet are decreasing, and we need to adopt processes that allow us to increase the availability of resources and reduce the dependency on finite resources. Regulatory compliance, especially in the state of California, you need to be aware of all the environmental regulations and standards to avoid fines and penalties. We're working with a plethora of clients that have been assessed by the state, and it is a really expensive and long process to get out of that. And then also innovation and efficiency. You will see that setting up a waste management program that is, supported by everyone in your facility, it will be, it will be an easy process once you have all those foundational pillars aligned. So yeah. Giving the mic back to Dr. Westworth.
Dickon, you're muted at the moment.
So thank you, Julie. Yes, so following her baseline waste audit with Engie, she returned and brought back an infographics with our results. As you can see here, we were actually already diverting about 71%, and with optimization, it was thought that we might even be able to get to as high as 82 or more %, which is really encouraging. So what we did is we created a museum piece of materials and types that go into each waste stream, and we put them out on these tables like this with the various waste streams, as you can see. Staff could then pass through and learn the various waste streams. Then after about 2 weeks, we had small groups come through, as you can see at the next slide, if it will advance. I seem to be having issues with advancing the slide. Okay. They would come through and they would do a table sort. So we put all those clean materials on a table, and then small groups of staff members would come through, and we had the 4 different segregation bins out for them. And then they would put them in, hopefully, the correct place. And so this kind of fun game drove buy-in and engagement and ensured a practical understanding of what and how much can be diverted from landfill, which is really, really important. So training our team, inspire them, show them how much can be diverted. Start simple, look at easy wins on a single waste stream. Have patience. Behavioral change takes a long time, and we're still working at it more than a year in. And find allies, find charismatic influences within your team who are going to help drive and evoke change, and then communicate clearly and repeat that messaging. And obviously reward and celebrate the achievements. And I'll show you some examples of that in a minute. Really try to get everyone on board, educate why environmental responsible waste management is so important. So following that little table sort trial, we then had a short PowerPoint presentation to the staff, and then show them how, facilitate, make it easy to do and understand, so that it can become the norm and that they want to do it rather than being a chore. And this is a great veterinary article from Dr. Duncan's group at CSU, published in 2023, on the importance of a waste pilot, as Julie was talking about, and how to do it. And this work highlights many opportunities, with emphasis also on the importance of behavior modification. And I do recommend you read it. Now, some simple, immediately implementable actions. One would be aluminium recycling. So if you make up baseball-sized foil balls of suture material, scalpel packets, and this size can be readily segregated at your recology or other recycling center. Tiny pieces sometimes are much more challenging and may fall through. But with a really state-of-the-art facility, even small pieces can be recycled. Then also think about reusable autoclavable instrument tins for surgery. This can massively reduce the amount of blue wrap that is used, which is a polypropylene-based product. We've also now got distilled water dispensers. We've had this for a couple of years now. We use this water for autoclave, lab equipment, coffee machine even, and has reduced the carbon emissions from transported distilled water bottles, the plastics, so the waste from all those plastic containers having to come in, and also the cost. And we're transitioning to reusable surgical gowns and hopefully in time drapes. The ones we've gotten in at the moment are by Standard Textile. Many of us have already transitioned to using cotton washable surgical caps. Now, these surgical gowns are based on polyester. They're washable, they're autoclavable and reusable up to 70 times. They're all AAMI level 1 through 4. We're using 3, which is the same quality, actually better than that with the disposables, and they don't tear. They have substantial decrease in the carbon for the material production, manufacturing, and then water use, and also trash over the lifetime of those products. These single sterile peel pouches are often used for surgical extras. So for lighter things, though, like a lap sponge or a lighter instrument, just a single wrap is more than sufficient. And you can basically halve the amount of waste instead of doing this double wrapping. Obviously, if it's a heavy instrument and it's more likely for puncture through, then you should double wrap them. Now, also carefully review your main surgical kits. Try to be lean, but limit the need for these routine extras that otherwise just increase waste. And certainly don't open just in case for surgery. Really have them on standby, but only open them if needed. And long-term, our aim is obviously to move away from disposable surgical procedure kits almost entirely and replace them with reusables. And then we can reuse everything from the ball, suction, and cautery, etc. Now, these environment pouches, these are reusable replacements for the peel pouches. They can be used up to 200 times. They are a bit expensive, but they're a really good option for the more commonly required surgical extras. And then in your break room or office reception. So what we've done is we've transitioned back to proper, I call it, crockery and cups, plates, bowls, cutlery, glassware, reusable coffee mugs, water bottles. We have filter water stations everywhere. So we're really trying to limit the amount of disposables, whether it be water bottles for single use, or ostensibly compostable plates, etc., which are still waste. And this was really simple, easy when many staff were really engaged around this. Other simple things in your office would be, printing on both sides, printing on 100% recycled paper, or really preferably just don't print. TerryCycle have many great options, including things for the more difficult to recycle options. This would be one, the multi-laminate pet food bags. So this is our front lobby. And clients, we can engage with those, and the clients can bring back their multi-laminate pet food bags. We also have one in our food room. We also have one for coffee pods. And then the Pet Sustainability Coalition, I just want to introduce them because they have 185 members of distributors, manufacturers, suppliers, etc., pet food products. And they're really leading the transition for the industry to move away from towards sustainable packaging and away from those multi-laminate hard to recycle bags. And some members have actually signed on to a packaging pledge to have 100% recyclable, reusable, compostable packaging by 2025. And it's just so great to have an organization like this around. So as Julie was talking about, waste segregation into bins that are clearly labeled, that are clearly colored and consistently placed is really important. Contamination of waste streams is best offset by compliance at the site of origin. And this is where, teaching and educating your staff is so absolutely critically important. We don't want custodians having to dig through trash. That's just not appropriate. And I always tell people, put in landfill or general waste if you're unsure whether it should be, in organics or it's recyclable. Now, in some instances, we also want to make sure that we're not having more general waste go into regulated waste streams because they're like sharps, because they're just so much more expensive, both for carbon footprint and dollars. And so we really want to keep things like these syringe cases, packaging, gauze squares, and even some of this tubing out of these regulated waste containers where possible. And this is, a more simple transition that we're doing at the moment before we get fancy bins. We're using the bins that we already had, and then we're using infographics that we got from our local Recology Center. This is really great because people can have an easy signage just above or on the bins themselves. And then everywhere in a hospital that we have a hand washing station. We also have compostable hand towels that can go into compostable bins. And then we also compost all our general food scraps. We have bins in our break room and elsewhere. It's really important not to wish cycle or to thrope. I think that's now an Australian term for wishing, hoping to when you throw something away. That's really important so we don't have further contamination of waste streams. This is more of a close-up of some of our infographics that we're placing. And then we have in our break room a zero waste guide for people to read with more information. And then also these infographics with more information posted in our break room. So something that it's been really great to work with is Polycarbon. They're a company with a gamma carbon program. This offers a mailback service for any brand of non-soiled or non-fouled nitrile gloves. And that nitrile glove stream is then used as a filler for manufacturing for a variety of construction goods in the cement industry. And this keeps these gloves out of landfill and incinerators. So these bins are pretty big. They're made out of cardboard and they can hold up to about 40 pounds. And we've collaborated with other hospitals in our local area. And that's another thing, try to collaborate where you can. That's really creates buy-in across your community of veterinarians as well. Now, on the right side, you see here a bin with another little bin, a hanging bin on top of it. So we had a lot of clutter and the various segregation waste bins. And we had a lot of staff discontent, honestly, and pushback. And it's fair enough. It was very reasonable. But we listened to them and we said, well, what else can we do? So we got these little hanging bins. So let's say you have a fouled nitrile glove that would go in your landfill bin. And for all the others that have just been handling a dog or a cat, but aren't grossly foul with vomit or feces, etc., they can go in these little polycarbon bins, which then can be transferred into their larger bins throughout the day. This really helped increase engagement, empower staff, and really help spur interest actually in other sustainability initiatives as well. And those little bins came from our friends at Busch Systems. This started our engagement. They're a great B certified company. They've partnered also with Carbon Graph. And so you can find a carbon footprint for any single one of their products. Now, something else that we've done and transitioned to is biodegradable nitrile gloves. So Neutrali, made by Vetflex, is a great company. They have a large warehouse down in SoCal, which is actually 100% solar powered, and they're looking at really decreasing emissions of transports, etc. So they and KVP Better Gloves, they've got a fully biodegradable ASTM approved and also FDA approved medical grade glove. And they have the same properties and shelf life as a standard nitrile glove, but they have this biodegradable drop-in technology, which increases the partial decomposition time for these gloves down to about 90% decomposition over 490 days or so, and basically to nothing other than carbon dioxide, water, and methane over about 5 years. Now, yes, it is true that these produce methane to some degree, but all organic products, anything that's plastic, produces methane. Only about 10% actually go to landfill because the vast majority we use are non-salt and go to polycarbon. And for us, fortunately, we have a carbon or a methane capture, which can offset some of that too. Now, still, I want to emphasize that when limiting, really it's important to limit the use of these nitrile gloves. For most common non-zoonotic infections seen in veterinary medicine, proper hand washing or use of alcohol gels is actually much better and more sustainable than nitrile glove use. It's actually been shown it can result in false insecurity, especially if not removed cleanly, and hand washing and arm washing don't occur between patients. And this was highlighted by a Gloves Off campaign in the UK, highlighting this amongst human care workers also. So very important there. Now, sharps containers, as we know, are vital to the safe disposal of sharps waste in veterinary and human medical facilities. We're now transitioning to reusable sharps containers, and these can be used up to 600 times. They're much safer with built-in ways to decrease sharps injuries. They cost less over time, and they're much more environmentally friendly. It's been estimated that 35 million disposable sharps containers are made annually. And by switching to reusable sharps containers, you can massively reduce the associated manufacturing and landfill waste and greenhouse gas emissions by maybe up to 95%. Now, we also have some more sustainable alternatives for dispensed pill vials. So these are Better Vials by KVP. These break down completely over 3 to 6 months in landfill with no residual microplastics, just like those biodegradable nitrile gloves we were talking about. Now, Palumina and others also now have these aluminium pill vials, and these could be really great because they could be infinitely recyclable. However, these are made out of 100% aluminium, that's virgin, and has probably 10 to 20 times the carbon impact of if they were fully recycled content. And then we're also always relying on clients to recycle for any benefit. Depending on the practices and clientele, this may or may not be done. So really have to consider that when using something like this, because otherwise it could actually end up being more wasteful. So Resynergy is a local company that we've been using. It's a super exciting state-of-the-art stuff. So it's a microwave-enhanced plastic pyrolysis plant. They can take traditionally very difficult to process plastics, including HDPE, which is like the number 2 from the peel pouches, LDPE number 4, which is from like wraps or bags, polypropylene, which is all the blue drapes, the surgical gowns, pack syringes, cases, bowls, all of it, and or polystyrene. And so when this is heated and turned into liquid hydrocarbon, distillates of which can then produce high-grade plastics again. And this is a really massive step towards a true plastic circular economy. Now, this is a waste reduction example following the intervention procedure done by our cardiologist, Dr. McDonald. We have Chris on the left. This is going to go to landfill, and Jenny on the right. This can all go to Resynergy. Now, long term, we're going to be trying to use much more reusable products, and so we'll cut down even that needing to go into plastic pyrolysis. Now, microplastics are a problem. We began with some of that and talked about the impact on human health and obviously other animal health too. And there are limitations to what we can do, but these are now ones that you can actually place retro on your own washing machine or on your commercial washing machine at your veterinary clinic. And these can filter microplastics up to 97% or more. Other ways to do this would be to wash on cooler, full load with less agitation, and hang dry rather than tumble drying, because laundry actually is one of the greatest producers of microplastics on Earth. The other are tires from your cars. Now, obviously, much of this is in the hands of manufacturers, and Patagonia and others are really trying to reduce the amount of microplastics that can be released from their products. And even for those who have passed to the afterlife, there are many more sustainable options than incineration for disposal of their bodies. We're now using aquamation. This is water and in a base solution. There's no on-site burning of fossil fuels. It's electrical, and it could even be zero carbon if they used renewable energy source like solar or wind. It uses a moderate temperature somewhere between 90 and 140 degrees Celsius under pressure. And the amount of water that's used is only about that would be required to wash a dog 3 times in a normal bath. And all that water is now filtered and then actually is taken out to agricultural land and used there as irrigation sources. So really a great way to reduce the waste and incineration pollution associated with cremation. So just a quick montage of some other things you could do to reduce waste. Obviously, please try to always recycle your batteries. You can go to more sustainable kitty litter options, including plant-based or clays. There are now compostable poop bags, even though poop bag might not be, poops from dogs may not be compostable because of risk for infection transmission. These bags break down and there's no microplastics from them. We've also transitioned mostly to durable potty-free, leak-free potty pads. And this has massively cut down our disposable potty pads, which actually create a huge amount of volume. And then long-term, reprocessing of single-use medical devices is a huge industry that's growing rapidly in the human medicine. And then also, reusable shipping boxes, like I was talking about before. When it comes to recycling paper, it's actually pretty egregious when it comes to carbon. So using reusable shipping boxes or shipping cold box containers is a really great way to do that. Now, finally, I really want to emphasize how important it is to celebrate wins and collaborate with your local community. We did this with our utility provider when we transitioned to 100% renewable electricity at our hospital. And we put on a combined celebration with the local Chamber of Commerce and representatives from Resynergy and Recology. Our local waste hauler came out, as did many other business people and also even general public. So great way to engage with your community. And so in closing, I really want to emphasize that isolated individual action, won't be enough, or clinic action just won't be enough. So I consider my purpose here today is to really encourage you to carry on the sustainability torch onto your practice, family, friends, and wider community, and move towards a more sustainable future where we can all thrive. Because amplification of our effort to reduce our impact through cooperation and collaboration is key. This is how individual actions can rapidly grow many magnitudes from ripples to create a tidal wave of change. Just imagine more than 21,000 US veterinary clinics with hundreds of thousands of staff millions of family, friends, and other businesses, schools, church, hobby groups. Our sphere of influence is truly immense. So you can make so much difference. So please join me and become an influencer. For our children's children's children, please make an impactful change today. And just before I finish, I do want to introduce my hospital sustainability team that I'm so proud of. It's only with a team that you can make a difference, and they've enabled such tremendous progress in transition to practicing veterinary medicine more sustainably at our hospital. Thanks very much.
Great. Thank you, Dick, and thank you, Julie, and hello, everybody. Apologies for my own technical problems earlier joining on, but I'm excited to be here with everybody. These were great presentations and lots of great information, and can't more than give a shout out and just thank you for that last point you're making, that we're doing this for a reason, and we're all trying to make an impact. And this is really a lot of what we're trying to do is crowdsourcing. We're learning from each other, and we're bringing these into best practices over time and seeing how we can transform the industry. So, as I've been dropping into the chat, obviously we're at the official hour, but we do want to take some questions and answers. I know, Julie, you've been responding to a number of the questions that have come in through the chat, but I'm going to go ahead and read some of these out loud just for the benefit of everybody else. If you do have additional questions you want to share with Dick or Julie, go ahead and type those in, and I'll do my best to try to get to as many of these as we can over the next 10 or so minutes. So let me start off with just a very timely one that had just come in for you, Dickon. Where is this? At your specific facility, are you using both nitrile gloves and biodegradable gloves in your clinic, or are the biodegradable gloves going into a compost stream specifically versus the regular landfill?
Yeah, so everything, no. So we really transitioned just to having biodegradable gloves just because we then have only one required, waste source. And so if they are fouled, they would go to the landfill bin, so just the trash bin. And if they're not, then they go to the gamma carbon. So in those little bins, and then off into the larger purple boxes as you saw before. So we just made it simple for ourselves, simple for the staff members. And sometimes these gloves come in different colors, et cetera, and people just get confused. So just to make it easy, and actually Vetflex gave us a really great price. Honestly, there's not a substantial cost differential. And we then know that we are doing everything we possibly can when that plastic goes into landfill. But I will tell you this, there is way more methane that gets released from your home stove or your home furnace, or all the piping all around every city in America that is ever going to come from these plastic gloves. So, but still, it's important to do everything you can. Otherwise, electrify your home. That's the next step.
And may I jump in as well? I think, to understand what impact, whether this is really important or not, you have to get an understanding of how many gloves you go through and understand, what the impact would be if you were to switch, and look at the cost, and also look at when you're rolling out those bins, how they are adopted by the team members. Is it frustrating? Is it working? What can be improved so you can make that easy if you are adding additional bins, or if you're adding these little hanging baskets, you always need to follow up with everyone.
Yeah, there are a couple of points I would add to what both of you are saying. First, just to start with biodegradable gloves, one thing I would point out, and you sort of, this was implicit in what you were saying, Dick, and I think, but do be careful. Even if they say they're biodegradable and you have a local compost program, that does not mean that they are wanted or can actually break down in a local compost program. So just be careful. We encourage using them, but definitely be reach out and understand what they can actually locally accept. In most cases, they could be problematic, and you want to avoid those.
Yeah, let me just state,
Yeah.
the biodegradable gloves are going to landfill. They are not going to compost sites. So biodegradable nitrile gloves are going to landfill if they've been fouled or are dirty. If they're clean, we would place them now into those polycarbon bins. Now, when we first started, we didn't have the biodegradable. So we only had the standard nitrile gloves, and that's what propelled us to want to use the polycarbon bins. Now we have also the chance to have these biodegradable gloves. Those biodegradable gloves are breaking down in landfill, and they have to go to landfill. They are not going to compost. I just really want to emphasize that point.
Great, thank you.
And the same thing with those biodegradable pill vials by KVP, those better vials, same thing with that. Those are going to landfill because many people aren't recycling their containers, and most of those, and many recycling plants, the end buyers of those materials won't take them if they've had pharmaceuticals or even if they've been labeled with medical material on them. So you have to be very careful. That's why you need to talk to your centers so that you can define what can and can't be recycled, and what does then need to go into landfill.
Great. Yep. All good points. That makes sense. No, there were a couple of questions that were in the chat about some of these specific services, and just to reinforce what I mentioned earlier in the chat, that these links that Dickett has included with his presentation to these different, I know it can be hard to grab those off of a moving slide in the webinar, but all these links will be available. We'll have these posted along with the recording after the program, and we will be sending out an email within the next day or two online so that you can follow up and access some of these. So just as a heads up. There's a question that just came in. So this is sort of high level, but if you're with a veterinary hospital and you're looking to get started with reducing waste, you sort of, the starting point for this zero waste journey, what from a sort of cost-effective, low-hanging fruit in a sense, what would be some of the recommendations of first steps you might take as you look to develop a program?
Julie, do you want to take that one, or?
Yeah, I can. So yeah, the three things that you would start doing is you would look at your current services and look at what materials are accepted from your current vendors. So this is also what Dr. Westworth was explaining. They reached out to their current vendor. That vendor had a lot of materials available, such as signage. They had information sessions, and then also you could do a waste characterization study. So look at what materials are being discarded in landfill, and then group them together and see what is the biggest category. If your hospital, produces a lot of blue wrap, for example, it might not be heavy, but it might be a bulk of materials. Or if we think back about the image that Dr. Westworth showed, of the two team members, one was holding the items that are going to Synergy, and one was holding the bag of waste that goes to landfill. So if you do the assessment of your current services and do a waste characterization study, you will find those categories, and then you can focus on the ones that have the greatest impact. The second one would be to add signage to specific materials. So we all know that cans usually go to recycling, paper usually goes to recycling. But in a veterinary clinic, you usually have items that are hard to place. I don't know. At home, my recycling vendor accepts different materials than, for example, the vendor in the clinic. So you want to have that specific signage, and that can be an easy thing. You can just have a picture on top of your bin, and you can say these items go here. And then the third one would be really cost effective. Look at items in your waste stream that can be reused. We found a lot of clinics are actually, blankets or pet bedding that can be cut up and it can be used as a rag or something like that. You can reduce the amount of chucks if you use a type of fleece and then, have that for the pets to lay on, and that can be washed. Or you could look at donations, what can be donated rather than dumped. For example, textiles again, you can, as long as they're clean, as long as they have been washed, you can donate textiles, even if they're tattered and destroyed. They will be processed by textile donation centers. Does that answer your question? Take that as a yes.
I might also just add that, just to reuse materials, just think about what you would do in an office space or at home. Instead of having single-use materials or things that people would compost, just go back to the old crockery and cutlery, things like that for people to use in the kitchen, in the staff rooms and things like that. That could be a really simple way. Those single water dispensers, stuff like that. It doesn't have to be veterinary specific even, but so many options can be, and you can go back to those reusable potty pads. That's a really easy thing to do. Sustainable kitty litter. That's a really easy thing to do. Battery and electronic waste. And as Julie was just saying, go back and contact your waste hauler. That would be, one of the very first starts. So you can really figure out what they can and can't take. But anyway, thanks so much for the questions.
And then also assess if that vendor is right for you. Sometimes you have been subscribing to services, but there might be another vendor available that might offer better services. So always evaluate your contract and see what is accepted and if there's a better option out there that you can switch to. That's another tip. And it can also result in cost savings.
Great. Let's take one last question, and then we'll start to wrap things up. But this, Dickon, if I can have you alluded to the Veterinary Sustainability Alliance. I guess can you take another minute just to talk a little bit more about what they do? There's a question: do they offer grants, or are there other things they do specifically? Can you just go a little bit more in terms of the organization and what they do?
Yes, so I'm one of 4 directors, and we're a non-profit US Canadian organization, and we're dedicated to preserving and protecting animal and human health by promoting sustainable practice methods. And we're trying to represent the whole entire North American veterinary industry. We're certainly in our infancy, but I certainly would recommend you go to our website. And at this time, we're building out a pathways online portal document, a roadmap, if you will, to trying to help practices be able to practice veterinary medicine more sustainably. And one of our outlines has just actually been endorsed by the AVMA and CVMA. And then we're going to have linked practical resource for veterinarians. We've also just actually completed a carbon calculator in conjunction with the Colorado State University and a master's student, Terry Ann, under Dr. Duncan's oversight. And we're also compiling a pilot with other clinics so that hopefully by the end of summer, and maybe autumn, we're going to have a little bit more information as we see how that initial carbon calculator pilot comes out. But we have kind of 3 main focus areas. One is clinical, another is on education, and another is on policy. And we're trying to form task groups around these. So I definitely would suggest people become a member, consider investing your time by joining one of these focused task working groups. And hopefully we'll continue to build this really important resource that we hope will be there for all of the North American industry.
Great. Thank you, Dickon. Yes, thank you both of you, Julie, Dickon. These are great presentations, a lot of great information here. We really appreciate the time you've taken to put this together, and really appreciate the passion you bring to this. This is how we collectively, again, as I said, share knowledge and how we advance and make a difference over time. So thank you very much. I just have a couple closing points I want to make. One is we do have, we're switching gears. I didn't get a chance to really introduce the webinar series that we do here at Busch Systems at the very beginning, but we touch always on different aspects of waste reduction, waste prevention in different contexts. We're shifting gears next month. We're going to be looking at the restaurant and sort of F&B side. And so we're going to have some great presentations from both looking at reuse systems for restaurants and to-go operations, as well as programs to manage food waste and also upstream food recovery and prevention. So mark it out on your calendar for October 23rd. We'll be sending out more information about this, obviously, as we get closer. I also want to point out, just in context of this program, this was specifically focused on veterinary healthcare. We did do a program back in January that was focused on broader human healthcare. A lot of, obviously, what we're talking about is there are universal aspects. So that's another great resource, and some good case study presentations from UCLA and Ohio State's medical centers that you can find there. And I put the link in here earlier, but we'll also send that out when we send out the recording. So as a heads up, we can go to the next slide. And just want to point out all these programs that we do, as I was just referring to, are archived online. We'll be sending out the email in the next day or two to find the recording for this, as well as slides, and encourage folks to check those out. And that brings us to the end of the program. I think I have one last slide. We will be sending out a survey. If it doesn't pop up when you log off, look for an email the next day. We'd love to get feedback that we can share with our speakers. What could we do to better improve these programs and make them more useful? So please feel free to respond to that survey when you see it pop up. And with that, we're at the end of our official program. And Julie and Dickon, I invite you just to turn off your screens. And so I will point out, for those of you who are not familiar with Busch Systems, we are a maker of fine recycling and bin products. This is the official end of the program, but I want to introduce and bring up my colleague, Michelle Dunn, from our sales team, who, if you're looking in the market for bins, she's going to sort of walk us through what's available. If you're interested, if you're not, obviously feel free to drop off. But this is how we make these webinars available, is through our core business. And with that, Michelle, let me hand it over to you.
Wonderful. Thank you, Alec, and thank you, Dr. Westworth and Julie, for such a wonderful presentation today. I've been with Busch Systems for 15 years, and as Alec mentioned, we are a bin manufacturer. We make bins with several different products, including plastic, melamine, stainless steel, metal, plastic lumber, you name it. We are a B Corp company as well, so really that stands for using business as a force for good. We really strive in terms of our highest verified standards for social responsibility, environmental accountability. We're very transparent in what goes in our products. As Dr. Westworth also mentioned earlier, we do have a carbon graph for all of our products that we manufacture, so you can really see the carbon footprint and the difference that each container makes. I'm here today just to go over some of the most popular bins for healthcare, for other environments as well, that I've seen over the years. And just walk you through the different steps and the different options. As Julie mentioned as well, programs can look very different in terms of what your budget allows. So as much as you would love one of those pretty aesthetic, well-designed bins that are very successful, we also manufacture bins that are within your budget if it happens to be lower, and anything smaller, as I'll start here. I know that it was mentioned today with our hanging waste basket. So these are very, very small, cost-effective bins, but can make such a difference in your program depending on what you're collecting. And I know that Dr. Westworth highlighted this today as well. These bins here, hanging waste baskets, we do manufacture them in several different colors, and they just kind of clip on to any type of bin. It doesn't have to be our bin for a smaller footprint. I'm just going to showcase here that they do have some flexibility in the back, so they can honestly hang off anything that you've got available, as you can see there, hopefully, depending on what's around and what you're looking to collect. And you can stamp this here in different options as well if you are collecting, you know, syringes or gloves. It's a little tiny for that, but just to give you an idea. So moving forward, this was also shown in the webinar today. This is our wastewater system. We have had this around for at least 15 years that I have been with Busch Systems. It has held to be quite successful in different programs. It is made with recycled plastic. As you can see, this is just a triple stream, but you can have a double, a single, a quad. They are modular, so you are able to build your program however you would like it and collect whatever items that you are looking to collect in your streams. These back sign frames here are optional as well, but they just help to highlight what goes in each stream, and you can customize them as well. So if you are looking to collect gloves, for example, you could have this, have a customized sign here that says gloves only with a customized label on the front. We do sell this in, or offer this in different sizes, 6 different sizes to be exact, along with different colors. So we've just showcased the blue, green, gray for the bodies, but we also have this in the blue, green, and black as well. And different sizes, you can see that this is a slightly larger, this is a 32-gallon size as opposed to the 23 gallons beside it. So you can mix and match if you have a higher stream. Let's say you were collecting gowns, for example, you could have this say gowns, you might want a larger opening. These do have restrictive openings. So this one here is for a single stream or a mixed program, but this one here is just a larger opening for waste, landfill. But again, if you were looking to collect gowns and you wanted something a little bit larger, that's an option as well. This system here that I have right now is on a dolly system, so it is movable, but that is also an option if you prefer it to be a standstill on the ground. That's an option, and you can connect these together. It's a hidden system here that's underneath the lid, but it helps to create a station, so one bin is less likely to be kicked away off to the side, go missing. It helps to create that full station effect and keep everything together neat and tidy. So, move this one out of the way. Feel free, if you have any questions at the end with any of the containers that I'm showcasing today, message in the chat or email in later. I'm sure our information will be there, and I'd be happy to help. I am the one that will be assisting you down the road in terms of helping you out with your program and different bin options that we have us to assist. Sorry for the noise, if you can hear that. This bin here is one of our newest additions to our lineup. It is the Mosaic. We're just showcasing it in a double, but again, because our systems are, many of them are modular, you can continue to add on to your program. So as different recyclables come on that you might add, depending on what you're looking to collect, you can continue to add on at a later date. This one here is a hidden connector system. So it's actually through this bar here. I'm not going to separate the bins or take them apart, but it's quite simple to do and quite simple to add on as well. This is showcasing mixed recyclables and waste, but again, we have a very talented graphics team. You can customize these signs completely to your program. This is another one back here just to showcase. Looks very, very different, but you could have gloves, you could have gowns, you could have recycled material, whatever you're collecting, batteries, light bulbs, you name it, you can change up the signs. We like this container because of the fact that you can easily see what goes in each stream, and you can see that from a mile away. Many people obviously already make up their mind in terms of where they're looking to put their items in their hands, so it's nice to have it showcased well ahead of time and be clear and upfront. These systems here, if I can just get them, there we go. They have a simple slide in. So as you can see, this is a hard plastic sign, recycled material that just slips in and out. So if your program does change as well, this sign is very, very easy to change itself. So we would just simply take it out and slide the new ones in. Again, it's on casters also, so it's an option for you to do that. You don't have to have it on wheels if that's something that you're not looking to have. And depending on your footprint and the space that you have available, you can also get these connected to the long side, so they can go across the wall and showcasing this side here. Hopefully you can see that. I can't tell if it's be shown, but and then stretch out your program if depending on the dimensions that you're working with. And again, the signs just come out that way. If this is front and center, this one here, it's showing no signs at the back, but you could have this in the middle where you can see and easily see all of the signage from all different sides. Each of the lids also has a custom or a label on the front of the lid. You can customize that also. We can work with your graphic or your artwork and then show a mock-up of what it would look like if you're looking to see, you know, what it would look like with your custom signage and your custom labels. Move this out of the way here. Just to touch on gallon size as well, that particular one was a 32 gallon size. The one that I showed before, we had it in 23 gallon, but all the way up to 32 and as small as 16 gallons. So we do recognize that different streams may have more to collect, maybe higher traffic areas. So several of our containers are available in either a regular or an Excel size to accommodate those different streams and the different needs.
Hey, Michelle, sorry to cut you off. We actually had a question from Julie herself. She was asking, is there an option for a waste station in the 7-gallon/10-gallon bin size that is modular and can be customized?
So we do have a few different options within the 7 to 10 gallon range. Actually, our Spectrum series, depending on the budget that you are looking for. This one here is made out of metal. I'm hoping that you can see it as well. It's our Spectrum series and one of the most popular series that we offer. In the middle here, these two slim lines, this is a 10-gallon size that you're looking at, and it goes all the way down to 8 gallons. It is made out of powder-coated metal, and inside each container is a liner as well. So these are ergonomic. They've got nice handles, very easy to lift up if you had to clean them out. But also there's cutouts on the side corners to keep your bags nice and tidy so they don't hang over the top of the container. They don't hang over the lids. It's a very tight knit, and it's very tight to the container as well so that you're not going to get any materials that are sliding in between the bin itself and then the liner inside. You can customize it in terms of the sign frames and signage at the back, as you can see here. Different shapes and sizes. This system here is anywhere from an 8-gallon size all the way to a 32-gallon size. Several different colors, as you can see. We've got white, blue, green, and black here. We also stock this in a gray size, and restrictive lids are an option as well. So this one here is the circle, but we've got the large full containers. We've got a slot. We even have a liquid option with this line as well. So different options here. And the sign frame is just a simple, I don't want to take it off, I don't want to be loud, but it just snaps into place in the back. So it's something that you can order after the fact. Casters are also an option. So if that's something that's important that you want to have the ability to move the system around, you can do that as well. And then if you're looking for something extremely cost effective, we do have smaller containers. I don't know if you can see them here. This is a 10-gallon size. Very, very easy. We also have it in a 7-gallon size as well. So this one here is particular. It's for mixed recycling, single stream opening, but we do offer a circle, a slot, a swing lid. This is popular. We have for organics even. Again, this is a 10-gallon. This lid simply comes off here, so you can get it with or without a lid. It just usually sits on the ground. In terms of height, you can see how high it is. It's made out of recycled plastic also. And then you can customize the label on the lid here just to show the different streams. And we also carry this in several different colors to highlight the different streams that you're collecting as well. So hopefully that helped to answer your question, Julie. Just to go back to the Spectrums briefly here, you can see labels on the front. These are stocked, but we also can do custom labels. Lots of people that lots of customers that I have choose to go with different labels on the front, maybe words down the front or pictures, again with the signage here. And I do have some that even highlight and with labels around the openings of the lid just to make their streams even clearer. Just gonna pull this one over. Most of the containers that I've showed you today are all modular, so that as your program grows, you can continue to add on, or you can continue to make it smaller. Several programs have gone from source separating down to single stream, And you can easily do that with just shortening those and then reusing the bins elsewhere with either a different lid option or just different labels and signs elsewhere throughout your facility. This one here, however, is an all-in-one container. It is a triple. We do offer it in a double. I think it's important to highlight with this one, I like the hinged lid and the different streams that depending on when they're full, it's very, very easy to change out. You can see that the lids are different colors as well to highlight the different streams. And inside, oops, sorry, we've got ergonomic liners that have a simple handle. They can also connect or clip onto the side of the bin just for ease of lifting. So it's just a matter of lifting of the bag. You're not bending down inside the container. It's very, very ergonomic and good for those that are cleaning and changing out the bins themselves. With everything, like I mentioned today, you do have the option of custom labels. These are custom labels to showcase on the front here, casters as well, and the labels on the lid are also a different option. It was mentioned briefly, just even battery bins. So Busch manufactures everything from larger outdoor containers to centralized containers to smaller desk side, even to battery bins. I'll just quickly grab one, sorry. We have these even as a different option, and we carry two different options. So if you're just looking for something small, again, in your facility that it's just a stream that you're not currently collecting, but thought after today's webinar, you know what, this is something that could make a difference and we should be collecting, we even have that option for you as well. So take a look at our website. We do have several different options, as I mentioned, from indoor to outdoor. We manufacture with several different materials depending on what you're looking for, and modular versus all-in-one containers like I showed you today. I'm hoping that my email will be in the chat as well. Feel free to reach out to me. We do have several different resources if you're not just looking for bins, but just want to chat about, you know, what is trending in the healthcare environment. I do work with hospitals and different healthcare facilities with education as well. So we can always chat about that. And of course, we have Alec Cooley as our senior advisor and our sustainability team that can help with those questions. So I'm not sure if there's any other questions that have come in at all, Tyler.
I do not see any further questions for you.
Okay, great. Again, these are just a tidbit of the containers that we do have to offer. We have a full line of catalogs to meet your needs. So don't hesitate to reach out, and I'd be happy to answer any questions that you might have along the way with your program and how you can help make it to be more successful.
Perfect. Thank you so much, Michelle. And thank you everyone for attending this month's webinar, and we hope you all enjoy the rest of your day.